Chapter 6 Quinolones and Fluoroquinolones. Chapter 6 Quinolones and Fluoroquinolones. Quinolones and Fluoroquinolones. Quinolones are a group of synthetic antimicrobial agents. Nalidixic acid is the older agent in the group. Oxalic acid and cyanoxacin are other quinolones. Chemical structure of quinolones: first generation nalidixic acid, second generation ciprofloxacin, third generation levofloxacin, fourth generation moxifloxacin. First synthetic antimicrobial agent. First synthetic antimicrobial agent. They were developed from structure modification of chloroquine. Nalidixic acid was the first quinolone introduced in 1967 for treating GIT and UTI, followed by its conjugate oxalic acid, flumecunine. In 1980s, fluorination of quinoline structure at 6th position and addition of piperazine moiety led to development of fluoroquinolones. Nowadays become more important in veterinary medicine. Nalidixic acid bactericidal against various gram-negative organisms like E. coli, Legionella, Enterobacter, Proteus, and Klebsiella. Its mechanism of action is same as that of fluoroquinolones by inhibition of DNA gyrase in the bacteria, discussed later. It is well absorbed orally. However, the plasma concentration of the free drug is inadequate to produce systemic effect because it is too rapidly excreted. However, it attains high concentration in the urine. Adverse effect: uncommon hemolytic anemia, particularly in G6PD deficiency individuals, allergic reaction, and CNS effect like headache, myalgia, drowsiness, and visual disturbance may be encountered. Use: it is a urinary antiseptic used in uncomplicated UTI due to E. coli, Shigella, and Proteus. It is also useful in treatment of diarrhea due to E. coli, Shigella, and Proteus. Oxalic acid and cyanoxacin have properties and use similar to nalidixic acid. Advantage of fluoroquinolones over quinolones. Advantage of fluoroquinolones over quinolones: wider spectrum of activity, fewer side effects, lesser chance of resistance, and attain high therapeutic blood level, attain high therapeutic blood level, better tissue penetration. Classification of fluoroquinolones. First generation quinolones, original quinolones. Primary active against gram-negative bacteria species, especially coliform, but not against Pseudomonas. Their use is restricted only for the treatment of UTI and GI infection because of their CNS toxicity, low potency, moderate blood and tissue level, limited spectrum, and high incidence of bacterial resistance. Example: nalidixic acid, oxalic acid, flumecunine, etc. Second generation fluoroquinolones. Fluoroquinolones. Addition of one or more fluorine atom and other substitution in the quinolones molecule yield fluoroquinolones with enhanced antibacterial potency, expanded spectrum, better tissue penetration, reduce toxicity and retarded development of bacterial resistance. Example: ciprofloxacin, danofloxacin, enrofloxacin, norfloxacin, pefloxacin, ofloxacin, etc. Third generation quinolones. Third generation quinolones. Unlike the first and second generation, the third generation is active against streptococci. Example: levofloxacin, lomefloxacin, zetifloxacin, moxifloxacin, sparfloxacin, etc. Mechanism of action. Mechanism of action. Fluoroquinones inhibit the bacterial enzyme DNA gyrase and topoisomerase 4 that are required for DNA replication and transcription. During DNA replication, there is excessive positive supercoiling of the DNA. This is corrected by the enzyme DNA gyrase by continuously introducing negative supercoil, and therefore this enzyme is necessary for DNA replication. By inhibiting the enzyme DNA gyrase, fluoroquinolones inhibit DNA replication. Topoisomerase 4 is essential for separation of the daughter cell following replication. Fluoroquinol FQ is also inhibit topoisomerase 4 and block the separation of daughter cell. This activity of FQ is primarily responsible for inhibiting the gram-positive bacteria, while DNA gyrase inhibition suppress gram-negative bacteria. The bactericidal action results from digestion of DNA by exonucleases whose production is signaled by damaged DNA. Bactericidal action is rapid and concentration dependent. The mammalian cell possesses an enzyme topoisomerase II analogous to bacterial DNA gyrase that also remove positive supercoil which has very low affinity for fluoroquinolones and hence are less toxic to the host cell. Mechanism of action of fluoroquinolones. Fluoroquinolones DNA gyrase interfere with correcting of positive supercoil, damage DNA, degraded by nucleic enzyme, bactericidal. Topoisomerase 4, separation of daughter cell, arrested multiplication. Antimicrobial action. Antimicrobial action. High activity toward gram-negative aerobe and against gram-positive aerobes. Most susceptible are the aerobic gram-negative bacilli, MIC less than 0.1 Ug per ml, especially the Enterobacteriaceae and Neisseria. The second generation quinolones are active against Mycobacterium, ciprofloxacin and ofloxacin, Mycoplasma, Chlamydia rickettsia, and inactive against anaerobes. Resistance may be due to mutation in the target enzyme. The drug loses its affinity for it. Change in the permeability of the organism to the drug. Several strains of E. coli, Streptococci, Gonococci, Salmonella, Pseudomonas, and Serratia have now developed resistance. Cross-resistance among FQ may be present. Protection of DNA gyrase by some protein plasma mediated. Pharmacokinetics. Pharmacokinetics administered orally IM, SC, IV, and also topically. Better absorbed after oral administration in monogastric pre-ruminant, and absorption is poor in ruminant but better in parenteral administration. Lipophilic, low degree of ionization, well distributed in tissue, bone cartilage, prostate, CSF, etc., cross BBB, and attain high concentration in CSF. High concentration liver bile urinary tract, partially metabolized in liver and excreted in urine and bile. Urinary drug concentration exceeds serum concentration, hence Low dose is sufficient in UTI. Drug interaction. Drug interaction, additive effect, beta-lactam, aminoglycoside, macrolides, antagonistic, nitrofurans, chloramphenicol and rifampin, fluoroquinolones plus metronidazole, extended spectrum, enzyme inhibitor interferes with the metabolism of theophylline, warfarin, cimetidine, etc. Food and antacid interfere with the absorption. Complex formation with metabolic ion Fe++, Mg++, Ca++. Toxicity. Toxicity. Relatively safe drug. In human, quinolones are associated with a small risk of tendonitis and tendon rupture, nausea, upper gastrointestinal tract discomfort, headache, and dizziness. Skin rashes and photosensitivity less common. Neurotoxic, sometimes prone for CNS convulsions, pregnancy, embryonic loss, and maternal toxicity. Dogs. In dogs, cartilaginous erosion leading to permanent lameness in young animals. Hence, not recommended for pups less than 8 months in small breed and 18 months in large breed, sometime within 1 hour of administration. Thoughts. Not recommended because of arthralgic effect. Administration monogastric and predominant oral, dominant parenteral. Dose of enrofloxacin 2.5 to 5 mg per kg 24 hours. Clinical application. Human urinary tract infection, STD, bacterial enteritis, pneumonia, septicemia due to gram-negative aerobic organism. Fluoroquinolones use ophthalmic infection of bone, joint, and soft tissue. Mechanism inhibit DNA gyrase and topoisomerase for bactericidal. Respiratory infection, inhaled anthrax, mycobacterium. GI abdominal infection, proctitis, UTI, MDR strain, STD, chlamydia. Adverse effect, tendon rupture, children less than 18 years, cartilage, pregnancy, category C, seizure prolonged, QT, dizziness, confusion, photosensitivity. In men, ciprofloxacin is the drug of choice in typhoid. In men, ciprofloxacin is the drug of choice in typhoid. Chloramphenicol was the original drug of choice for many years. Because of rare serious side effects, other effective antibiotics such as ciprofloxacin have replaced chloramphenicol. Also in meningitis, prostatitis, rickettsia, mycoplasma, and mycobacteria infections. Veterinary use. Quinolones have been widely used in animal husbandry and several agents have veterinary specific applications. Dinofloxacin, advocin, advocid, veterinary usage. Defloxacin, dicural, vetiquinone for veterinary usage. Androfloxacin, Betril for veterinary usage. Evafloxacin, Evaflin for veterinary usage. Marbofloxacin, Marbosil, Geniquine for veterinary usage. Orbifloxacin, Orbex, Victax for veterinary usage. Serafloxacin, Floxosol, Saraflox, Sarafin for veterinary use. Gram-negative infection. Cattle ship, goat pneumonia, Mycoplasma bovis and Pasteurella, E. coli and Salmonella enteritis, E. coli septicemia, Mycoplasma rickettsia, chlamydia, swine pneumonia of various origin, E. coli diarrhea, salmonellosis, mastitis, metritis, agalaxia syndrome in horse, dog not used in young and growing horse, dog and cat adult, urinary tract infection, respiratory tract infection, osteomyelitis, skin and wound infection. In poultry, enrofloxacin 50 ppm in water, mycoplasma, E. coli, fowl cholera, salmonellosis, erysipelas and bordetella. Enrofloxacin specific for veterinary use, weak activity to anaerobes. Thank you.